I chaired the committee on preterm birth, which was established by the House of Lords to do an inquiry because of the previous government's target of reducing preterm births to 6%, which now stand at around 7.9%. That target is never going to be met unless the government re-examines how they're going to reach it. Lots of people gave us evidence, including, importantly, mothers who were courageous enough to share with us their stories. For instance, a mother's experience when her babies were born at 23 weeks.
Just imagine this little baby immediately born, taken from mum and dad, hands on them, which had to happen to save their lives. But in went the needles, in went the tubes. And that was their first experience of life, way before they were ready for the world.
We also heard from another mother whose two babies were separated at two different hospitals and no accommodation was available.
It's impossible to emphasize how much leaving felt like a daily amputation. Each night I went home to a silent house where I would express, I would cry in the shower, and I would fall into bed for a sleep that was broken not by the cries of my children but by my alarm going off to tell me that I had to pump.
Whilst prevention remains the goal, and because the factors that lead to preterm labor are complex, it is difficult to identify individual risk. There is a disparity in incidence of preterm labor related to socioeconomic circumstances, lifestyle issues, etc. that need to be addressed to reduce the incidence. There are issues about guidelines that exist that will improve the outcome for babies. Our evidence found that there is a great variation in adherence to these guidelines, and that again needs to be addressed. There are other issues to be addressed to cut down and improve the outcome, and for instance areas of research that will identify why preterm births occur. Important too is that after weeks and months, sometimes longer, spending in neonatal nursery, when the babies are discharged home, mothers and parents feel they're not supported. And it is important that this support is provided by trained health professionals who understand the problem.
The big difficulty that we have, though, is that there isn't that support for families when they come home. Our recent Smallest Things survey, less than a third of parents told us they felt that their health visitor really understood all their baby's needs. And because of that, parents will tell us that they actually stop going to see their health visitor because they don't feel like the person who perhaps should be able to provide the support and help really understands what they've been through.
Guidelines are quite clear that age 2 and age 4, these children should be followed up because many suffer neurodevelopment and other disabilities. And whilst many do well, these babies need to have this assessment carried out, which particularly at 4-year-olds are not often done. And that too needs to be addressed. I hope there will be a coordinated effort from all government and other bodies to address this issue to make the lives of parents and babies better.